Hi everyone. Today I am going to discuss a topic Mycobacterium tuberculosis in different way, that is in the form of multiple choice questions. And here nearly 22 questions are there. Each question will be given with answer along with explanation also. So let us move on to the first slide. The first question is, which of the following is false about Mycobacterium tuberculosis? Option A, branching filamentous forms, Cox bacillus, acid fast bacillus, cell wall structure is very simple. If you see the right option for this, yes, the Mycobacterium tuberculosis are seen in the filamentous form. That's why they are also known as mycobacteria, because it looks like mycobacterium. Since invented by the Robert Koch, it's known as Cox bacillus, and they are acid fast in the staining procedure. They are resist decolorization with acid at 20% sulfuric acid. That's why they are known also known as acid fast bacillus. And their cell wall structure is very complex. It's not simple. It's a very complex. It's not simple. It consists of mycolic acid, mycocytes, lipoarabinomannan, peptidoglycan, so on. Different structures are present, so it's a very complex structure. So the false is answer D. Number 2 is, find the Jones bacillus from the following. Option A, Mycobacterium paratuberculosis. B, Mycobacterium marinum. C, Mycobacterium microti. D, Mycobacterium avium. So the other name for this Mycobacterium paratuberculosis is Jones bacillus. This Jones bacillus has got some typical features like they on acid fast staining. These bacilli appears in the granules like, and they usually produces the cold abscess, either in adults and also in children. So the answer is paratuberculosis, which is also known as Jones bacillus. Next one is, which of the following is not saprophytic mycobacteria? Basically, saprophytic mycobacteria means the mycobacteria which are living in the soil and also in the environment and in some parts of the body also. Usually they won't produce, not usually, they never produce any disease. So answer options for this question are, one is A, that is Mycobacterium smegmatis, Mycobacterium stercoralis, Mycobacterium butyricum, and Mycobacterium africanum. See, if you see all these A, B, C, D options, first three, smegmatis, stercoralis, butyricum, and all are saprophytes. Smegmatis is present in smegma of genital tract, stercoralis present in the stool, and butyricum is present in the environment. And last option D is the right answer, because Mycobacterium africanum is the one which produces the disease in Africa. You all know that there are three important pathogenic species are there. One is Mycobacterium tuberculosis, Mycobacterium bovis, third one is Mycobacterium africanum. And fourth one is, which of the following is not a pathogenic mycobacteria? Again, if you see the options, Mycobacterium kansasii, Mycobacterium scrofulaceum, Mycobacterium chelonae, and Mycobacterium smegmatis. The first three, A, B, C, are the non-tuberculous mycobacteria, but they produce some type of granulomatous lesions in the individuals. But Mycobacterium smegmatis is the one which present in the genital tract, and it never produces any disease. So the option D is the right answer, which is a not pathogenic mycobacterium. Next one is acid fastness of TB bacilli is attributed to. That means why this TB bacilli are acid fast in nature. Option A is presence of mycolic acid, B is thick cell membrane, and C is lipoarabinomannan, and D is peptidoglycan. So here if you see the option A, the presence of mycolic acid is the correct answer. because it won't allow the acids and also antibodies into the cell. The B is the wrong answer. The cell membrane is like any other bacteria, and lipoarabinomannan this is it plays a major role in pathogenesis of bacteria. And D, that is peptidoglycan, is not of course responsible for acid fastness, but mainly the peptidoglycan is responsible for integrity of cell wall. So the right answer is the right answer is A, that is presence of mycolic acid. And which of the following is acid fast positive with 20% H2SO4? That means while you are doing the acid fast chaining with the following organisms, which resist the decolorization by using 20% H2SO4, sulfuric acid. So the option A is Mycobacterium tuberculosis, B is Mycobacterium leprae, C is Nocardia, and D is bacterial spore. So here if you see the Mycobacterium tuberculosis, which is the right answer, but why not the other three? Mycobacterium leprae acid fast positive with 5% H2SO4, and Nocardia is positive for acid fast staining at 1 to 2% H2SO4, and bacterial spores also around 1 to 2% H2SO4 they are resist. So the highest acid fast resistance is shown by Mycobacterium tuberculosis, that is with 20% H2SO4. So the right option for this question is A, that is Mycobacterium tuberculosis. Next one is the most common mode of transmission of tuberculosis. Even though all the options are correct, like inhalation, ingestion, and inoculation, but here the question is the most common mode of transmission. For that, the answer would be inhalation. Sometimes it by ingestion also, let's say ingestion of or consumption of unpasteurized milk also can produce Mycobacterium tuberculosis, which get transmitted from animals through the milk, and consumption of such kind of milk without sterilization results in this particular problem. And inoculation also possible, like prosectors nodules. In case of dentistry, a dental surgeon will suffer with tuberculous lesions. So in one way, all are correct answers only, but the most common is inhalation is the most common method of transmission. And 10th question is, a female present with active TB delivered a baby. Means mother is suffering with active tuberculosis but delivered a baby. All of the following are indicated except. That means which of the following is not to be indicated? A. INH for baby. Uh, yes, always INH has to be given to the baby, and withhold breastfeeding. See, this bacteria will never secrete in the breast milk, so we can allow the mother to go for breastfeeding. And C is give ATT to mother. Since mother is suffering with active tuberculosis, so we have to give the anti-tubercular treatment for a minimum of 18 months. First 6 months intensive, like next 6 months, 12 months, I have to give the different course as prescribed by the chest physician. And proper disposal of sputum by mother. Always have to give the instructions to the mother to dispose the sputum properly, because it's a highly infectious material. So answer is B, that is withhold the breastfeeding is the wrong answer. Next one is essential lesion in tuberculosis. Yes, option A is cavity formation, B is scarring, C is degeneration, and D is avascular granuloma. If you see all these options, more or less mimics, and cavity formation you can see here. Scarring also can be seen in case of skin tuberculosis, or cutaneous tuberculosis. Degeneration also possible in the involved tissues and organs, and avascular granuloma. If you see here, the first lesion followed by the infection produced by this bacterium is tubercle, which is also known as avascular granuloma. That's why the essential lesion, the definitive lesion produced here is D, that is avascular granuloma. If this avascular granuloma heals in the proper time with proper treatment, you may not able to see the cavity formation, you may not able to see the scarring and degeneration. So essential lesion, that means if you would like to say some person is suffering with tuberculosis, there should be a lesion like a granulomatous lesion in the site of infection. Next, the 12th one is primary complex. Which of the following is exception related to the primary complex? A. Subpleural focus of infection, hilar lymphadenopathy, asymptomatic, hematogenous spread. Yes, here the early stage of the lesion, you can see the foci of lesion in the subpleural area, and from this subpleural area, infection will be drained into the hilar lymph nodes, so you can see the hilar lymphadenopathy. And in this particular case, patient may not have the typical symptoms of tuberculosis. And D, that is hematogenous spread, is common. That's a wrong answer. Hematogenous spread is not possible in early stage of primary complex. Early stage of the disease, that too in case of primary complex formation. This is a late stage of the disease, which can erode the blood vessels, and the hematogenous spread is possible. So the answer here is D. Next one is the spinal complication of disseminated tuberculosis. Of course, this tuberculosis get disseminated into various organs of the body, and produces disseminated tuberculosis. So the first one is Pott's disease, B is lupus vulgaris, C scrophaloderma, and D miliary tuberculosis. So here the Pott's disease is the answer, because the spinal complication of disseminated TB is the Pott's disease, which usually involves the lumbar region of the spine. And of course, the cervical spondylitis also possible in case of spondylitis also possible in case of disseminated tuberculosis, as far as the bones is concerned, or skeletal system is concerned. And lupus vulgaris, this is a kind of skin disease produced by the tuberculosis, and scrophaloderma is also another type of skin lesions produced in cutaneous tuberculosis. And miliary tuberculosis, where the seeding of this bacilli in various fields of the lung and gives rise to a millets-like appearance on X-ray, which is known as miliary tuberculosis. So this is miliary tuberculosis is confined to the lungs, not to the spinal or spine. So the parts disease is the right answer because the lupus vulgaris and scrophaloderma related to the skin, miliary tuberculosis related to the lungs. And fourth one is, which of the following is false about tuberculin test? So tuberculin test usually being done to know the delayed type of hypersensitivity in individual, or to know the seroconversion of an individual for the tubercular proteins. So the option A is recent conversion is indication for anti-tubercular treatment. B, INH prophylaxis for closed contacts, and no risk in negative cases, and false negative in immunocompromised individuals. So the false here is, first we will see what are the true answers. Recent conversion is indication for ATT. Yes, whenever you see the tuberculin test positive, you have to start the anti-tubercular treatment. And B, when the people are having close contact with the person with the active case of tuberculosis, we have to give the INH isoniazid as a prophylactic drug. And C is no risk in negative cases. See, the tuberculin test is not the definitive test for the diagnosis of tuberculosis. Sometimes it may give the negative results also, like false negatives, because of so many reasons, in case of immunocompromised state and all. So even though the people are having negative results, we have to compare with other clinical manifestations on other diagnostic modalities, and then we have to see for the treatment possibility. So don't think that if the tuberculin test is negative, there is no any risk. And D, that is a false negative in immunocompromised individuals. Yes, this is always possible. In case of immunocompromised individuals, the cell-mediated immune response will be less, so you can get a false negative results in spite of the disease. So the answer here is the C, where the tuberculin test negative cases should not be considered as no risk cases. 15th one, which of the following statement is false about Mantoux test? A, subcutaneous route, that means antigen has to be given a subcutaneous route, and induration, once you give this antigen, after 48 to 72 hours of incubation, inoculation, you have to see for the erythema and induration at the site of injection of tuberculin unit. So induration more than 10 millimeters is definitely always significant, and the dose to be given, that is C option, is 0.1 ml of tuberculin unit has to be given as a dose, and it always indicative of delayed type of hypersensitivity in the individual. And if you see the option A, that has been given as subcutaneous route, which is absolutely wrong answer, because this is always intradermal test. This is an intradermal test, so subcutaneous route is not preferable to give the tuberculin unit to demonstrate or to see the Mantoux test. And 16th one is the true about IGRA, that is interferon gamma releasing assay. Interferon gamma releasing assay in TB diagnosis. What is the true about it? So the first option is, this is first generation quantiferon TB gold with SAT6, and second generation, B option, is second generation quantiferon TB gold with SAT6 and CFP10, and C is useful to distinguish between Mycobacterium tuberculosis and Mycobacterium bovis, and non-tuberculous mycobacteria won't give positive reactions. So if you see one by one, This is a first generation quantiferon TB gold with ESAT6, which is a ESAT6, which is a specific antigen for tuberculosis. That is the right, but this is not the first generation quantiferon TB gold. If you go for the second B option, there which has been given like second, this is second generation quantiferon TB gold with the ESAT6 and CFP10 antigens. So once you receive the blood from the patient, by using this particular two antigens, that is ES86 and CFP10 antigens, we are going to demonstrate the specific sensitized T lymphocytes against these two important antigens of tuberculosis bacilli. So that's the right answer. And C1 is that is useful to distinguish between Mycobacterium tuberculosis and bovis. That is not at all possible. Mycobacterium tuberculosis and bovis both will produce same type of immunological reactions in the individual. And D is NTM, that is non-tuberculous mycobacteria. They always give the especially Cancerci and Scrophulatium, I believe. These two will give the positive reactions with IGRA, which are false positive reactions will be given. So the right answer is B, all other wrong answers. Next one is, which of the following is false about tuberculosis? A. Chemoprophylaxis with INH. Uh, yes, that's the right answer. And the standard regime include rifampicin, INH, and pyrazinamide. And the BCG vaccination available as free-dried vaccine. That's also right answer. And D, the serological tests are more sensitive and specific. Remember, the wrong answer is the serological test. I think in theory class also was mentioned about this one. In the 2012 itself, the serological tests were banned by the central government of India. The government of India. So there are no serological tests available like IgM, IgG, IgA varieties of antibodies should not be done to diagnose a case of tuberculosis. So there is no any place for the serological test to diagnose, which is a wrong answer. And 18th one is, which of the following is false about TB test turnaround time? That means turnaround time is since the time of giving the sample or since the time of sample taken from the patient and again to get the report, what is the time to be taken? That comes under the turnaround time. So the total time which is required to get the result from the time of sample collection to the time of obtaining the results of that particular test. So which of the following is false about tuberculosis diagnostic test turnaround time? So A is CBNAT in 3 days, that is cartridge-based nucleic acid amplification test may come in 3 days, and LJ medium report will come in 6 to 8 weeks, and C BACTEC reports will come in 2 to 3 weeks, and line probe assay results will come in 2 days. And if you see here, among all these, the fastest report will be given by the CBNAT. Just within 2 hours, we'll get the report, but here option given like CBNAT in 3 days, which is absolutely wrong answer. All others are right answers for this particular question. And find the wrong statement about BCG vaccine. Yes, live attenuated vaccine. Yes, this is live attenuated vaccine only. This is prepared from the animal strain, that's Danish 1331 strain is used for the preparation of the BCG vaccine. And intradermal administration, yes, it will be given like intradermal route only. And C option, prepared with the Danish 1331 strain of Mycobacterium bovis, and given after first month of birth, which is a wrong answer. This vaccine has to be given to the baby as soon as birth. You should not make any delay in giving the vaccine. So given after first month of birth is a wrong answer. The right answer is it has to be given as early as possible after birth. Next, the complication of BCG is not. That is the exception of complication of BCG. Yes, the BCG vaccination is responsible for lymphadenopathy, it's responsible for fever, it's responsible for keloid formation at the site of vaccination, but it never responsible for encephalitis. So the answer is encephalitis. So BCG vaccination never produces encephalitis. And which type of pulmonary tuberculosis most likely to give sputum positive results? Remember, the people who are suffering with tuberculosis, all types of tuberculosis never produces the disease, never produces sputum positive results. Only the open case of tuberculosis can produce can give the sputum positive results. So here the option is primary complex, fibronodular tuberculosis, pleural effusion, and cavitatory tuberculosis. First, we'll come to the A, that's primary complex. As we mentioned already, in primary complex, lymph nodes gets enlarged and the focus will be there, and that particular lesion or secretions in the contents of that lesion will never come in contact with the airways. So the sputum will never give positive in case of primary complex. It has to be diagnosed only by X-ray findings. And another thing is fibronodular, means if the hilar lymph nodes gets fibrosed, that is called fibronodular. This fibronodular lesions is a state of recovery from the primary complex. So you can't see the sputum positive results here. And third one is, that is C1, is pleural effusion. Here also the sputum cannot give the positive results because there is no access for this pleural fluid to the sputum. So this is not possible. And cavitatory lesion, yes, this cavity is always comes in contact with the airways, that major airways. So while sputum is coming, the bacteria also get released from the cavitary lesion, and the sputum positive results you can see. So the answer is D in this particular case. Next one is XDR-TB is defined as follows. And first one is rifampicin, resistance to rifampicin and INH. Remember, resistance to INH and rifampicin, such kind of bacteria or strains are known as MDR-TB strains, not the XDR-TB strains. And the next one is the fluoroquinolines and INH and rifampicin resistance, and this is also not correct. And fluoroquinolines and kanamycin and rifampicin, this is also not to be considered XDR-TB, but XDR-TB is considered as when the people are suffering with the resistance with fluoroquinolines and aminoglycosides along with the INH and rifampicin. That's why the answer is D, where the fluoroquinolines, INH, rifampicin, amikacin resistance you can see. So this is about the MCQs with the explanations from the topic Mycobacterium tuberculosis. Happy learning.